Medical Tourism Corporation interview of Dr. Paul Ramesh Thangaraj, Cardiothoracic Surgeon, has extensive experience in India and the United Kingdom.
I'm Dr. Paul Ramesh Thangaraj, and I was educated mainly in Madras in my schooling and medical college at Madras Medical College. I finished my undergraduate training here and then went to the UK. So I did my entire general surgical as well as cardiothoracic surgery in the UK. I spent about 10 to 11 years. I got my FRCS in general surgery as well as the FRCS in cardiothoracic surgery. I returned here as a consultant in 2002, so I've been practicing for 6 years now. My main training was a rotation between Oxford and Cambridge, and I also worked at Newcastle Freeman Hospital. The thrust of my training in Oxford, in addition to the routine cardiac surgery, coronary bypass valves, etc., was I worked with Professor Stephen Besteby, who is a pioneer in artificial hearts and left ventricular assist devices. So I got a lot of exposure both the research side as well as the clinical side with left ventricular assist devices. The thrust of my training both in Papworth and Newcastle was in transplant centers. Both are extremely high volume transplant centers, the top in Europe. So I've been exposed to the entire range of both heart and lung transplantations. The majority of our work in Apollo involves cardiac, and in terms of cardiac, it's coronary bypass surgery, both beating heart surgery as well as on bypass surgery. But both my colleague Dr. Sundar and I specialize in high-end, high-risk cardiac surgery. So that could be valves with coronary bypass with aneurysm, and a combination of these surgeries in patients who have multiple comorbid conditions. We do it because there's a lot of attention to detail intraoperatively as well as postoperatively in order to get these patients through, and our results have been excellent in this high-risk group. In terms of thoracic surgery, we have done the range of minimally invasive thoracic surgery, which involves mediastinoscopy as well as video-assisted thoracic surgery. We do both palliative lung cancer as well as lung cancer treatment in terms of lobectomy and eminectomies. We also do things like lung volume reduction surgery, which is done for emphysema or COPD. Why is a group practice superior to a single consultant practice is that Dr. Sundar and I have been trained in basic cardiothoracic surgery, but his emphasis has been on things like pulmonary thromboendarterectomy and minimally invasive lung, whereas I've done more transplantation. So the fact that between us, the range of operations that we perform is certainly more than what the individual can. And you would find in any unit, consultant is assisted by someone who is less experienced. Whereas in our group practice, when I operate, he assists me, or when he operates, I assist him. So there are two fully qualified consultants functioning as a team all the time, whether it's intraoperatively or postoperatively. And should a problem arise in the ICU while we're operating, there's always one person to go and take care of patients. So we find that consultant-led care is 24/7 in a group practice, rather than delegating it to someone who may be in training. So we certainly find that the outcomes have improved than when we were operating individually. Nursing, excellent post-operative care, critical care groups and critical care consultants who have to take care of you, and rehabilitation specialists. So where the surgery forms about 40 to 50% in terms of the impact on the outcome, it's all these ancillary services that count. Which I think is available at Apollo. And certainly in terms of response time, and as I said, we do get a lot of patients who require operations for lung from abroad, and they find that the waiting times here are much less, even for getting histopathology reports, microbiological reports. So overall, I think your stay would be short and pleasant. We can arrange through telemedicine, direct consultation through telemedicine or through the email, where we can advise the patient, and certainly although there are limitations with that, we can advise them coming once a year back to India for a follow-up. For most valve cases, I think if they followed up once in 6 months or a year, that's more than sufficient. And even echocardiograms done there can be relayed to us through telemedicine or through the internet, so we can look at that here and give advice back again. So there are multiple options for these patients.
Medical Tourism Corporation facilitates affordable medical treatment at world-class international hospitals. fill out the estimate request form on our site for a free quote and more information.